is gallbladder surgery? So sometimes patients will come in complaining of mid-epigastric pain or right upper quadrant pain, and they don't know what the etiology of this pain is. So therefore, what we like to do is usually work them up. What do you mean by working them up? We ask them to get appropriate tests like ultrasound of the right upper quadrant, or a Hiatal scan or nuclear Hiatal scan, which will show the ejection fraction of the gallbladder, and this will give us more information to know if the gallbladder is indeed the problem of why the patient is having this pain. So people have asked me and come to my office, Dr. Choi, do you think what would happen if I don't have weight loss surgery? Well, as you know, when you do have a BMI greater than 40, you have comorbidities called hypertension, diabetes, sleep apnea, high cholesterol. So what people don't understand is with 70 to 80% excess weight loss within the first 6 to 12 months, you have a 70-80% chance that your hypertension and your type 2 diabetes will go away, and you also have a 70% chance that your CPAP machine will go away, and in addition to that, your cholesterol levels will be decreased. As a result, all those decreases will help you fend off having a possible heart attack in the future. Why is it so important that you have the surgery? Because there is a 70% chance that your sleep apnea will resolve. Why is that important? Because the CPAP machine that you're using, which makes noises and which bothers your significant other while you're sleeping, will not be there anymore, and your marriage will be better, and your wife or husband won't complain about the machine keeping them up all throughout the night. So one type of surgery that has been popular but not so popular this day and age is called the lap band. So the band in its heyday was placed over the G junction, and then it was closed. And what you would do then is you would come in periodically every 4 to 6 or 8 weeks to get injection of saline, which would fill this balloon up and would reduce the amount of foods that you can and can't eat. Now, the problem with these bands is sometimes, even though you would have security or your surgeon would secure the band in, sometimes the band can slip. And that was a problem that has become more frequently for some patients, or have had a prolapse of their stomach and therefore has discomfort. So therefore, this surgery is no longer as popular as it was in the past. So sometimes people have had the band in for about 5 to 10 years. Some people have more than that. And so what is becoming more popular these days is sometimes just taking the band out and then putting the stomach back into normal position and then converting the stomach into a gastric sleeve. So what we're discussing, sometimes you might be diagnosed with a hiatal hernia. And how do you find these out? Either you've had severe reflux or you've gone to your gastroenterologist and he's done an endoscopy. So when your bariatric surgeon or surgeon goes into your abdomen laparoscopically, he will see the hernia. And if he does recognize a hernia, there are 2 ways to correct the hernia. He can do a posterior correction or an anterior correction. And obviously the posterior correction is a little bit more guaranteeing of reflux prevention in the future. However, both are acceptable in this day and age. Another question is what are the requirements to have weight loss surgery? And what we use is something called BMI, the body mass index. It is the calculation between your weight to your height. And therefore, the standards guidelines by the American Society of Bariatric Surgeons states that you must have at least a minimum 29 BMI to be a candidate for weight loss surgery. Sometimes we still get patients who've had bands and they call us and they say, can I get a lap band fill? So what is a lap band fill? A fill is This port is underneath the skin, and what I need to do is I need to put a needle inside here and put saline fluid, and what that does is fills these balloons, pouches that are around the stomach, and as you come in every 6 to 8 weeks to get more liquid, the entrance to your stomach gets smaller and smaller because of the fills. So some other questions that come in, they're like, Doc, what is a VSG or vertical sleeve gastrectomy? Well, it's the same thing as having laparoscopic gastric sleeve. What we do there is cut about 70 to 80% of your stomach so that it looks like a banana. Patients have asked me about the success stories. I think that all patients will have a success story, and what success story that really keeps into me or keeps in my mind is about a fisherman that I had operated here in Florida. This gentleman had gone to numerous places and did not have any luck and couldn't get his insurance to cover the surgery, but eventually he came to me and he was over 400 pounds, and now he's lost over more than 100 pounds with the gastric sleeve, and his hypertension and his diabetes have resolved. And I think that that is probably the most rewarding thing about doing weight loss surgery for people here. Sometimes surgery isn't the panacea for all patients. Some patients were like, well, you know what, Dr. Choi, I'm not really interested in having surgery, or I might not be able to afford that surgery, or I'm not willing to go through all the obstacles of getting it approved by my insurance. So what are some of the alternatives? The alternatives is that 90% of weight loss is your diet. So if you can go and we can help you get a dietitian to control your caloric intake, and in addition to that, you would have to start exercising. And I know people are like, oh, I don't want to exercise, but I'm not asking you to go and run a marathon. I'm just asking you to start walking at night, maybe 30 to 45 minutes, and then after that leads to an hour. But as the key to weight loss is always diet. Diet is 90% of weight loss, and if you can control the amount of food that you're putting in your body, you will have success losing weight in the future. So sometimes we have patients that come in and we find out that their insurance doesn't cover their surgery or bariatrics. Why is that? Because the company that they work for or the insurance that they bought has an exclusion policy which does not allow them to have bariatric or weight loss surgery. So what do you do then? So now you have to become a self-pay patient. What does that mean? That means that you would either have to become a self-pay patient, which means you have to pay cash, or you would have to get financing. And we offer financing here, and you can look up the financing companies through our website. So it can happen. You might overeat and you will feel like, oh my God, I don't want to do this or feel like this ever again. So what do? I recommend my patients go and take a walk, and also to walk around their house or to walk outside to help the food that has gotten stuck to pass through. And number two is don't try to drink water or try to push it down through by drinking, because it won't happen. But the main thing is just to relax, a walk, give it time, and not try to force or push any of the food that has been blocked through by trying to think that you can push it by over drinking or trying to drink so much water. This won't happen. This would only make you get more nauseous and more sick. Another question that has come up a lot is that what is the scarring, or what are the incisions like when you're having gastric sleeve? So now with the newer trocars, the incisions are not that big. That most are be like 8 millimeters, which is less than an inch. And what we do here is that we close you plastics. What does that mean? We put the sutures underneath the skin so they dissolve underneath the skin, so therefore you don't need to remove anything after in your post-op clinic follow-up. So therefore the scarring is very minimal, and of the 5,000 cases that I've done, no one's ever complained about our scarring. Another question that's come up is what is a weight loss doctor or a weight loss surgeon? There is a plethora amount of answers for this. However, if I was looking for a weight loss surgeon, I would look for someone who was minimally invasive trained, who did a year fellowship, who does a lot of surgeries, meaning he doesn't do 1 or 2 gastric sleeves, gastric bypasses, or any surgery per month, who does a lot. I know that there are some people who aren't fellowship trained, but they're a little bit older than me, that were not formally trained but are good physicians also. But if I was looking for a weight loss surgeon, I would look for one that is board certified, fellowship trained, and does a lot of surgeries here in Florida. Another question that we've been asked is that what makes a bariatric surgeon or a weight loss surgeon? Well, if I was looking for a weight loss surgeon, I would look for one that was MIS fellowship trained, meaning minimally invasive surgeon or surgery trained. In addition to that, I would also want one that is board certified, and also one that does more than 1 to 2 surgeries a week, meaning that does 10 to 20 surgeries a month, or does a minimum of 50 to 100 surgeries a year. Those would be my standards for, or criteria, what I would be looking for in a weight loss surgeon. So sometimes patients come up and ask, hey, Dr. Choi, will I have a big scar from having weight loss surgery with you? And I automatically always tell them no. So most of the times the trocars have gotten a lot smaller, meaning that the instrumentation has gotten smaller, so therefore I don't need to make big incisions. The biggest incisions might be 5 millimeters to 8 millimeters, which are less than an inch. In addition to that, a good laparoscopic surgeon will never ever have to open you, meaning that they won't need to make a big incision midline or scarring. Sometimes that can happen due to complications, but for the most part, a good laparoscopic surgeon won't need to have, or will need to open you or have a big scar midline. What we do after is that we close you plastics. Some people like to staple you, but I like to close you plastics, meaning that all the incisions will dissolve underneath the skin, and your scarring will be very, very minimal. What is BMI? BMI is called your body mass index, which calculates your body fat to your height and weight. So the minimum amount of BMI for you to have weight loss surgery by the American Society of Bariatric Surgeons is 29 to 30. So another question that's come up a lot is sometimes they're like, Doc, can I have coffee after gastric sleeve? So it's a touchy question. Why is that? Because as you know, caffeine in coffee is like a diuretic. And so why is that important? Because since you've had 70 to 80% of your stomach removed, you're not going to be able to get all the fluids that you can. It's going to take a little bit longer, and we don't want you to become dehydrated. But eventually you'll be able to have some decaffeinated or caffeine later on, months later in the future. But in the near term, within the first 2 weeks, we try to stay away or shy away from having coffee. I've been asked sometimes, there's questions, well, Dr. Choi, you know I'm not obese, but I have this severe burning or reflux or gastroesophageal reflux, and I wanted to know if there's anything that we can do for that. Yes. So what we would do is we would get proper testing, pH monitoring, EGDs, 24-hour acid monitoring, and probes in order to make sure that you are a candidate for some type of anti-reflux surgery, which are something called toupees and Nissen fundoplications. But those are options for people who are not obese and are complaining of heartburn. So I've been approached by many of my patients and say, Dr. Choi, I have heartburn or reflux and I don't understand what that is and I'm not obese. So sometimes there's a chance that you might have a hiatal hernia. And how do you diagnose that? Either your gastroenterologist or an upper GI or X-ray will find that out. Now, if you do have a hiatal hernia, we will have to do some more testing. We'll have to get a 24-hour pH probe and manometry to make sure that you do have some problems with your stomach. And once we find out that this is the reason or possibility of you having gastroesophageal reflux, we will recommend treatments, surgical treatments like Nissen fundoplications or toupees. In the future, there will be a fourth surgery, in my opinion, that will become very famous, and it will be called the single anastomosis duodenal ileal bypass. Why will this become popular, in my opinion, is because it will be for patients who have had gastric sleeves and have failed and now need to have a revision. Although the protocol now is to have a sleeve and convert it into a bypass, you won't get as much weight loss with the bypass, but you will get a significant amount of weight loss with the single anastomosis duodenal ileal bypass, or what they call today SADI. So what is a SADI? So a SADI involves after a sleeve gastrectomy has failed or the patient is put on weight. So what we will hook or make an anastomosis from the intestines to the duodenum, and we will count back from the ileal area 300 centimeters, or some people like to go more, and make a new connection here at the duodenum and connect the ileum or the small bowel to make that bypass. So once we get the information back and we know for a fact that the gallbladder is the etiology of the pain and there is no ulcer or anything else in the stomach, we will do a gallbladder surgery, and it's called a laparoscopic cholecystectomy. It's about an hour worth or less time of having your gallbladder removed. It is 4 little incisions, and usually you will stay in the hospital for at least 23 hours or you will be discharged the next day. Gallbladder problems can affect anybody. It doesn't matter what BMI or what size you are. So therefore, it just affects everyone. There is no specific type of person who has to have gallbladder problems. It affects everyone from any BMI and at any age. So as you know, Ozempic and semaglutide has become a very, very popular drug for weight loss surgery. Wegovy and other drugs that are becoming popular. So the issue with that is that it does work. What is the mechanism of semaglutide? It slows down the emptying of the stomach, so therefore it makes you feel full longer and also makes you feel satiety, so you don't look for food and start eating food again. However, there are some side effects. You'll have nausea, some people will have vomiting, some people will have dry mouth, but those are individualized, so it doesn't mean that every single person will have those issues. But the most important thing is that it is kind of expensive if your insurance doesn't cover it. And in addition, we don't know what the long-term effects of having semaglutide and taking that as an injection once a week for 4 to 6 weeks. But in the near term or now, it seems to be working, and it can be used in conjunction with some people who've had weight loss surgeries in the past and need that little special bump to help them get those 5 to 10 pounds off for the future. Sometimes after having weight loss surgery with me, people are like, well, what do I do? What do I eat? Or how can I contact you? Well, there's many ways. So you can call our office, you can text us, or reach us through our website, number 1. Number 2, the diet. We will give you a pre-diet plan and post-diet plan so that you can follow. So what is that like? So the first week is basically clear liquids. The second week is full liquids. The third week is soft diet, and then the 1 month diet is having regular foods but in smaller quantities. And in addition to that, one of us in our office will be calling you every day to make sure everything is fine and if there's any complaints. And also, I will possibly be calling you to make sure that you're okay. And then after that, the 1 week post-op visit, you'll come and see us and make sure everything is fine. So pre-surgery is also a little complicated, but we will help you through charter and navigate through the waters. What does that mean? So sometimes people who have hypertension and diabetes that come and present to my clinic, I like to get them stress tests and blood work. In addition to that, even if you don't have any comorbidities, I still like to get a blood work and EKG done. Why is that? So that we know that everything is normal prior to surgery. However, if a normal EKG and normal blood work are not normal and they become abnormal, then I like to get a stress test. The stress test will show that there is no blockages or there's no problems with the conduction in the heart, and therefore those are the main things that I like to get prior to surgery in order to see that you're a great candidate to have weight loss surgery with us. So sometimes people have asked me, Dr. Choi, is there a sign of that I've overeaten with my gastric bypass or gastric sleeve? And I will tell them yes. Some of them are that you have become nauseous, that you are burping, you are hiccuping, or you will have some pain in the stomach. And those are signs that you have overeaten. So how do you prevent those things? So many people that I have seen or heard have stated that they make a smaller plate. They'll get like a butter plate or a bread plate and fill that plate up, and if they have eaten that much of food, then they know that they can possibly go for another second plate. If not, then they know that they have to stop. Other things is to take time while you are eating and to chew very conservatively. And then the last thing is that to also have maybe frequent meals so that you don't have to have big meals at each setting. So in the United States, the most popular surgery right now is the gastric sleeve. So what is the gastric sleeve? The gastric sleeve is when you cut 70 to 80% of the stomach and make it look like a banana. And some of the patients have stated, oh my God, you're cutting 70 to 80% of my stomach out, Dr. Choi. Why is that? Because within that portion of the stomach that I take out, there's a hormone here called ghrelin, and that is responsible for hunger. So my patients tell me after the surgery, Dr. Choi, I'm not as hungry anymore, or I don't look for food as I did prior to the surgery. And that is the most important thing about having gastric sleeve surgery. In addition to that, as I stated, that your stomach now looks like a banana or is in the shape of a banana. It's not as big as like this as the stomach. So why is that important? Because you're not going to be able to eat as much food as you did in the past. So therefore you might eat like 2 or 3 bites, or you might not eat as a full hamburger as you did before, but maybe you'll eat a half or a quarter. So that's why it's called a restrictive process. So gastric sleeve not only is a restrictive process, but also it prevents you from being hungry because of the ghrelin portion that's removed out of the greater portion of the stomach.